I've verified my orders. I've made sure that this patient is the one that needs the catheter. I would come in, introduce myself. My name is Melissa Medina. I'm going to be your student nurse today. I'm going to wash my hands for 15 seconds. Can you tell me your name, your first name, your last name, and your birth date? These are my 2 patient identifiers. I would verify these against my orders, or I could also use his wristband and verify that against my orders too. So I would be looking, this is his first name and his birth date here. Make sure that's the correct patient. Your doctor's ordered a catheter today to ease some of the urinary retention. We're going to place that in. It's going to be a tube that goes into your bladder. We'll fill the balloon up with some water to keep it in place, and it's going to allow the urine to drain into a bag. This will help ease some of that discomfort, okay? If he has any questions, he could ask those at this time. I'm going to pull his curtain. I'm going to raise his bed up to a comfortable level. I'm going to ask him to rate his pain scale on a 0 to 10. If he's in a lot of pain and discomfort, I might pre-medicate him just to help with that. I'm going to pull your blankets back and look at your abdomen if that's okay. I'm going to pull his blankets back. I'm first going to look at his abdomen. I'm going to see if there's any distension, any masses, anything that I need to be aware of and concerned about. I'm going to just slowly palpate and ask if he has any pain or discomfort. Like I said, if it's too bad, we may give him some medication just to help ease that. I'm going to pull his blankets back. I'm going to lower this bed rail here. I've gathered all my equipment already. We're going to be doing some pericare before we place the catheter in place. Since his curtain's already closed, I'm going to pull this back a little bit. I'm going to place his bath blanket on. I'm going to pull this up just a little bit more. I'm going to place my gloves on. I'm going to place a towel here just to help keep from getting this bed wet. I have another towel here. I've already got some lukewarm water going here. We're going to take the first wash rag and we're just going to clean in a circular motion. I have my linen barrel here, so I'm going to get rid of that one. I'm going to take this one, clean in a circular motion. We're just working our way down. I'm going to get rid of that one. I'm going to do this one. And do it again. Get rid of those. Do this one. Get rid of those. I'm going to take my towel here and I'm going to just dry them off. I'm going to gather these up, take them here. I'm going to put my bath basin here and I'm going to push this out of the way for now. That would have gone back out in the hallway. I'm going to take my gloves off, throw them in the trash, perform my hand hygiene again. I'm going to move this over here. And we're now going to open up our catheter kit. Move the table. I'm going to put this bag at the end of the bed and we'll use it for trash later. I'm going to turn this so I can open it away from me. Just the outer corners. Open this side. Open this one. And pull back. I'm going to take my gloves out. Place them here. Since the outer edges are dirty, I'm going to grab it right in the middle and get rid of it. So now I'm going to take this out. I'm going to put the shiny part down. I'm going to fold it in, making sure not to touch the patient. I'm going to take this one here. We're going to open it up, and we're just going to drape it over in. I'm going to take my swabs here. I'm going to open these up. Place them here. I'm going to place these in my bag down there, so I don't need them. And open up these swabs, place them here. Throw those in our tour bag. I'm going to take this out just a little bit. I'm going to go ahead and hook up my syringe. I'm going to get rid of my cap because I don't need it. Now that that's open, I'm going to open up my lubrication, pour some here. I'm going to get rid of that because I don't need it anymore. I'm going to go ahead and lubricate my catheter. I'm going to take my normal saline and pour it onto these. With my non-dominant hand, I'm going to grab onto him. I'm going to take the first one, start at the top, and go into a circular motion. And without going across my sterile field, I'm going to go around and throw away. The second one, we're going to do the same thing. Go around here, then we're going to go across. The same thing here. Go out and around. And last one. Go out and around. Now that I'm done with this, I'm going to go ahead. This is lubricated already. We're going to take this whole thing and move it down here to the center where the patient is. I'm done with this table a little bit. I'm going to go ahead and get it out of my way. My tube has got lubrication on it already. I'm going to have him take a deep breath and try to relax. And I'm going to place the catheter in 6 to 9 inches. Or until I see urine return. Once I see urine return, I'm going to go in 1 more inch. And then fill it up with water. Or normal saline. This is going to keep our balloon in place. We're done with this stuff. So I'm going to go around and throw it away. Now that we're done with the actual sterile, I'm going to take this here. I'm going to unravel it. I'm going to connect this to our catheter, our thigh strap here. Now that that's in place, I'm going to hook my bag up here on the side of the bed. I'm going to take my strips here, sign my name, sign the date. I'm going to put one here. I'm going to sign my name, sign my date, and I might put it around the top here. I'm going to get rid of this. We're done with all of this. So we're going to get rid of it. I'm done with my gloves. I'm going to take them off, get rid of them, wash my hands. I'm going to make sure my patient's not in any pain or discomfort. I'm going to cover him back up. We're going to remove all of our junk from the end of the bed that would be in the garbage. Pull his blankets down. Remove this one. I'm going to put his side rail back up. I'm going to make sure he's comfortable. I'm going to lower his bed back down. I'm going to bump it just to make sure that it's locked. sure he has his call light. I'm going to make sure that he understands how to use it, and that if he has any questions or concerns or any discomfort, that he can press it and I will come in. I'm going to make sure that his side rails are up, make sure that he's comfortable. I'm going to give him his side table back and all of his personal items. And then I'm going to wash my hands again for 15 seconds. I'm going to then leave the room and I'm going to document. I'm going to document the size of the catheter. I'm going to document the amount of fluid in the balloon. I'm going to document the color of the urine. I'm going to document how the patient handled the procedure. And then I'm going to come back within 30 minutes and check on him again.